Hi YouTube, I am not a dentist, but I am 28. I've never had a tooth removed, including 3 wisdom teeth. Now that's just luck. Some people have to have their wisdom teeth removed. But, hey, guess what? I do not brush 2 times a day. I don't even brush every day. There have been times I don't even brush every 2 days. Okay? I'm just being honest. And some people do need to floss. That's just the way their teeth are. I don't hardly ever floss. There are a few teeth that really need it. Occasionally I really do it to get those itsy bitsy pieces out. I get lucky with my structure, okay, the way I naturally developed. But this is specifically on how to brush your teeth. What I am trying to stress here is that it is not frequency. It's not how much toothpaste you use. It's not whether you use mouthwash or not. It is technique. And this advice comes directly from the best dental hygienist I've ever had. She set me straight, and I was very lucky to have a cleaning from her. Okay, you know to do the circles in the front. That works for some of the area of your teeth. Now towards the back, it can't you can't do it. Well, you gotta do it. Just because you can't do the circles, that doesn't mean you're done brushing your teeth. Any way you can. You need to get those molars, you need to get them all around from every angle you can, and you need to be aggressive. I don't, pain really is just something you're going to have to deal with. Sorry. So do the circles, but that's really that might be 40% of the job at the most. Obviously, you cannot do circles on the back teeth. For them, you apply a vertical technique, okay? And you're going to feel it. When your gums are healthy and your teeth are healthy, you're going to feel the action. So, circles in the front are most of it. Vertical in the back should do it, you know? And as for the tops of your teeth, she told me, this brilliant dental hygienist, just give them a once over. Because if you do the right job on the sides of your teeth, the front and the back, they're going to get pretty well covered anyway, just by proxy. So just give them a good once over. People really stress, I think, a little bit too much, um, the importance of getting the tops of the molars. I mean, once over, that'll do. Um, and another thing, you might think that there might be some recesses in your molars that look gray or dark, and it looks like there's these really foreboding recesses in there. If they're not painful, do not worry about them. They are not cavities, they are recesses, which are natural, okay? And if you are not in pain, don't worry about it. And if you go to the dentist, okay, and he recommends removing a tooth, get a second opinion before you do anything from another dentist with a doctorate, okay? 2 of them, maybe even 3 dentists. I mean, there are some quacks out there, and they are so smug. They're like, oh, I was in a very well, I was in the mental hospital one time, and they had a quack there. I went to see the dentist, and he said, yeah, we're gonna remove this one and this one and this one. And I was like, what? My dentist, he didn't say any of these recesses were a problem or anything like that. And this smug son of a bitch, this quack, You know what he said to me? He said, "It's just standard dentistry." He even said with this smirk, this sneer, like, "It's just standard dentistry." Okay, that's what I'm trying to tell you. Okay, patient, heal thyself. Take some responsibility. You know your body better than anyone else. Hopefully, the advice on the brushing helps you out. But again, frequency alone, that's not it. That's not it. It's good, it's important, but it is technique above all else. And if you have to floss, do it. Depends on your tooth structure. We're not all flossers. Not all of us have to be. Although occasionally we all have to be. Okay, goodbye.